Well, as of Friday, we'll be reporting 600 fewer deaths with COVID. The Ministry of Health is changing the way it does daily reporting, meaning only those whose death was a direct result of COVID or it was a contributing factor will be counted. It takes our total death toll from 1,870 to 1,252. There are 788 people in hospital and there were 10,424 new community cases reported today. But epidemiologists have long been saying the real case numbers are likely to be far higher because of a lack of reporting. The Ministry of Health says it'll now carry out community testing to get a more accurate picture of the scale of the pandemic and the new variants among us. Alexa Cook explains.
Rats are quick and easy, but officials worry they're not providing an accurate tally of COVID cases. So they're rolling out a new infection prevalence survey, testing different groups of Kiwis from different regions, and a serological survey, blood testing for COVID antibodies.
That will give us an indication of just how many people have got antibodies to, so immunity to COVID-19, either from the vaccine and or from infection.
Something epidemiologist Michael Baker has long been calling for.
People, myself and others, have been asking for this survey really since the start of the year when Omicron arrived.
While the surge in cases appears to have levelled off in the past week, health officials say we aren't out of the woods.
At this stage, we are still expecting further increases in cases and hospitalisations.
We have other variants, unfortunately, waiting in the wings that may behave differently. And that's why, unfortunately, this pandemic is much more prolonged than we'd hoped for at the beginning.
And as the pandemic drags on, the ministry will change the way it calculates COVID-related deaths.
Shifting away from reporting all people who have died within 28 days of a COVID-19 infection to people who died because of their COVID-19 infection or where it was recorded as a contributing factor.
Because of this system change, the total death toll has actually dropped by 600 to just over 1,200 since the pandemic began. Michael Baker says there is no perfect system to measure COVID deaths, which have been underestimated around the world.
Quite often people are dying not of something else that is caused by COVID-19, but it's not recognised. And this would be things like strokes and heart attacks.
But health officials hope the new system will better reflect the true toll of the virus. Alexa Cook, Newshub.